is May 4th, and as you would have noted, the curfew has been extended for another month in our efforts to flatten the curve and to contain the spread of the coronavirus disease in our country. As I reported on Friday, May 1st, 2020, which marked day 50 since our first index case was reported, the number of confirmed cases continues to climb, and in less than a month, we have had a 110% increase. Our healthcare workers continue to work selflessly in order to protect us all. But you continue to behave very selfishly, with total disregard for your own safety and for your own life. With regard to the social distancing guidelines, you have interpreted them to suit your own agenda. Not only are you continuing to congregate in large numbers, but you're also there way past the curfew time and with no face mask for your protection and those around you. Fellow Guyanese, it is extremely unfair to those who are following the guidelines to be placed at unnecessary risk. From the inception, you were all told that we can stop COVID-19 from spreading by simply staying home and following all the precautionary guidelines. That advice is still in effect. You know all these guidelines, so please adhere to them so that we can get on with our lives and our livelihood. We are reporting 10 new cases, bringing the total number of confirmed cases to 92. The number of persons recovered thus far has increased to 27. However, our COVID-19 deaths remain at 9. 639 persons have been tested, of whom 547 are negative. There are 3 persons in our COVID-19 ICU, 7 in our institutional quarantine, and 56 in isolation. To date, the total number of patients seen in the COVID-19 ICU is 25, with 7 deaths being registered within the ICU. Total number of persons who recovered and were discharged from ICU is 3. The global report for today is as follows. According to WHO, there are 3,349,786 confirmed cases with 238,628 deaths. In the region of the Americas, the number of confirmed cases is 1,384,641 with 78,409 deaths. Tomorrow, as we observe International Day of the Midwives, I wish to take this opportunity to salute all the midwives around the world, and especially in Guyana. Today, I have with me Ms. Marcia Francois, President of the Midwives Association of Guyana, who will bring you a special greeting in commemoration of this significant event. Ms. Maria Francois.
Thank you, Minister Lawrence. Good afternoon. I am Midwife Maria Francois, President of the Midwives Association of Guyana, attached to the Georgetown Public Hospital Corporation. And it is my extreme pleasure to join with the nurses, and midwives fraternity worldwide to extend special greetings on the occasion of International Day of the Midwife 2020. Colleagues all, tomorrow 5th marks the 10th year since the Midwives Association of Guyana joined the rest of the world on the annual observance on the International Day of the Midwife. Today, we mark this special occasion under the theme Midwives with Women. Celebrate, demonstrate, mobilize, unite. Our time is now. With support from the United Nations Population Fund, the association was formed in 2010 to ensure that international commitments in relation to the midwifery were realized, particularly since empowering of midwives was considered and still is the key to help in stopping preventable maternal and newborn deaths. Like so many countries in the world, the Midwives Association of Guyana can boast that it is among the first set of countries registered with the International Confederation of Midwives. To date, midwifery support groups and regional focal points are established in all 10 administrative regions of Guyana, originally led by Ms. Gillian Butts Garnett and then strongly supported by Ms. Mandy LaFleur of the Ministry of Public Health. The association continues to capitalize on the opportunities provided every year through the observance of the International Day of the Midwife for us to publicly demonstrate our commitment to support midwifery care and services and to help to focus on policyholders on the need to support us in our quest to provide quality care and services. However, this year 2020, because of COVID-19 and the social distancing that is in effect, our public meetings have not been possible. The year 2020 is dedicated to nurses and midwives, underscoring the invaluable care that we provide. As we unite with other health professionals in the fight against COVID-19, we must recognize the important role that we have to play. In the midst of this global pandemic, midwives have risen to the extraordinary challenge to support one another in the fight to protect mothers and babies. While the times are tough, we need to be reminded on the overwhelming solidarity that have emerged from the maternity units around Guyana. The consistent members of staff are pulling all efforts to provide excellent care. I encourage all our midwives to continue social distancing, to use our personal protective equipment, and to adhere to good hygienic practices. We have heard of the many woes in relation to maternal and infant morbidity and mortality. So let me take this opportunity to call upon all midwives, all members of the midwifery team, including the doctors working in the midwifery, all leaders and administrators to rally to one cause, to provide the support needed for midwives to practice competently. Let us put our best efforts together and make it happen. Let us continue to make a contribution to the fulfillment of the Sustainable Development Goal, especially number 3 for Guyana. Mindful of our theme, Midwives with Women, celebrate, demonstrate, mobilize, utilize, our time is now. Let's pull together all our strength so that as a people, a country, we can curb all preventable deaths in Guyana and ensure that mothers and their babies live to enjoy a fulfilled, happy life. I want to especially thank the executive members of the Midwives Association of Guyana for their commitment in ensuring that we achieve our set plans. We also wish to express profound gratitude to the Minister of Public Health and her team, the Office of the Minister, the Chief Medical Officer, the Deputy Chief Medical Officer, the Chief Nursing Officer, and the Permanent Secretary, and the regional health administrators and managers, and also the hospital administrators of all the hospitals in the country. Thanks for the support. Thanks to United Nations Population Fund, Pan American Health Organization, and our other midwifery supporters for always being there for us when we need you the most, technically and financially. In closing, I quote from a World Bank panel in the 2011 State of the World's Midwifery Report that states, the returns on investment on midwives is a best buy. Midwives are a best buy for maternal and newborn survival, and is a best buy in primary health care, yielding a 16-fold return on investment when taking into account the cost for their education, and comparing this with the cost of C-section that can be avoided. May God bless us as we continue to fight to save lives. Happy International Day of the Midwife. Stay safe. Thank you.
I thank you, Miss Maria Francois. I wish to thank also all the midwives for attending to the needs of our pregnant mothers and our neonates in this pandemic. Once again, we value your care, consideration, and sacrifices. We are continuously praying that you will draw strength from those of us who are standing firmly with you, even as you work with those pregnant mothers that may be affected with COVID-19. Thank you all, and God bless you. Please stay tuned for the dashboard that will provide you with today's update.